Today on In Focus, with award-winning host Yesenia Taveras. Right now, online, is special guest Mental Health Global Network's co-founder Kelly Marzoli on WITN 22. Hello, welcome to In Focus. I'm your host Yesenia Taveras, and joining me today is the co-founder of Mental Health Global Network, an organization that is helping individuals to learn more about mental health, to normalize mental health, and to connect them with individuals who can help them to recovery. She joins me now. Welcome to the show.
Hi, thank you so much for having me. And I think it's the perfect time to talk about mental health.
It definitely is. The COVID-19 pandemic has hit our country very hard, and it kind of blindsided everyone in regards to their mental health. It was one thing that probably wasn't at the forefront of many people's lives. And as we can see today, it is a critical condition through so many people's lives right now in this journey.
Yeah, definitely. And even before COVID, we were experiencing a mental health crisis. And it makes sense that during a period of economic downturn, the high rates of unemployment and homelessness and isolation just in general would affect overall mental health.
Yes, and let's get into that, Kelly. Let's talk a little bit about how mental health has kind of introduced itself to your life at such a young age. I know for me, it's a common theme here in my household. I have 2 children, and we constantly talk about our mental health, making sure that they know that it's a normal thing. It's not something that's in the dark or looked at badly. So talk to us in regards to how it impacted your life.
Absolutely. I'm so glad that you mentioned that you're open about mental health with your kids because, the youth are at risk. And when I was younger, there wasn't education. And growing up, we had physical education, but I never really learned anything about mental health besides maybe seeing a psych asylum that was dramatized in the media. So growing up, I didn't really know how to cope with my own emotions or how to express them. And I experienced bullying in high school, and I definitely went through a lot, even experiencing suicidal thoughts. And since then, there's been a lot more movement in the media, and we've seen a lot more public suicides, which has contributed to more awareness, which is great. However, our institutions are still lacking mental health education. And even once I overcame my own personal issues, I still wasn't really that aware, and I didn't check on the people around me as much because I just didn't realize that suicide could affect my life or that I could lose a loved one in that way. And in 2016, I lost one of my best friends, Connor Mullen, to suicide. And losing him, turned so many of our lives upside down. But it also hit home because he was someone that you would never expect to be struggling. He, made everybody else laugh. He was caring for others, and he was athletic, and, he was excelling in a lot of areas of life. But that scenario, although it's so painful for so many of us who knew him, and a lot of people know that same pain, it just shows that these issues don't discriminate, and these issues are real and just as life or death as someone having a cardiac arrest. However, there's not as much training or education in our institutions and schools and in companies. We're not prioritizing this. So that's why we started MHGN, to start implementing training and to bridge the gap between the regular person and mental health care professionals.
And let's take it back to your friend Connor, because I want to shed light on how mental health affects so many people who can appear on the surface to be living a great life. And I want to make sure that people know that this could be your friend. This could be someone next door living to you. Talk to us about how there was really no signs that you can see, and how you're trying to open up the doors to conversations for friends like yourself and Connor, who could have had these conversations early on to try to prevent something like suicidal, because suicidal thoughts, unfortunately, happens to a lot of people more than we know. And it happens behind closed doors in the comfort of their own home. And it's not a topic that's talked about.
Absolutely. Stigma is a big factor. Stigma is when we make negative assumptions about something. And with mental health, it's kind of labeled as a weakness or as taboo to talk about, like people hide it. And that affected Connor. He didn't want his friends to judge him. There's a lot of pressure socially about that sort of thing when you're, coming of age in college and in that age group. And also, with that being said, I was uneducated. So I didn't even know, you know what I mean? We live in surface level conversations where we're just like, hey, how's it going? What's up? And we don't take time to really like look. Now I do, because now I know more than I did, but we certainly failed Connor. And in retrospect, after he passed away, through part of our healing, we had to reflect on what happened to him. And even though there usually are signs and symptoms, they're not always visible to everyone. So I saw some things that maybe his mom didn't, and his mom saw things that maybe his friend group from college didn't see. So, self-medicating is a big one. Connor was drinking more than usual, maybe experimenting a little bit. And I didn't say anything. I was just like, oh, cool, like whatever. And now I would have a totally different reaction, because that can affect mental health as well. But again, we need to be presented with the signs and symptoms from a young age. And we also need to teach the youth to just openly talk about how they feel. If we're training people how to save someone's life from cardiac arrest, then why aren't we teaching people how to respond to problems with the central console of the human body? Like, our brain is essential to everything. And discussing that mind and body connection. And unfortunately, we had to learn the pain of suicide, and we had to experience this tragic loss to kind of bring these topics to the forefront. And that's what Connor's legacy will continue to be, is just like helping people like him. And hopefully our society will respond positively to that.
And Connor's legacy does continue through his suicidal death. Unfortunately, you and your co-founder came together to birth Mental Health Global Network. Talk to us about the beginnings of that and how this all came about for the two of you, and what's the mission of Mental Health Global Network?
Yeah, absolutely. Our mission is to prioritize mental health on the same level as physical health. People don't always respond to mental health issues with the same urgency or compassion as they would. Like, if someone's in the hospital with a broken leg, you send them flowers, you help pick their kids up from school, you at the very least ask them if they're okay and check in on them. So that's how we need to respond. And Juliet Meskers is my partner. And she also lost a friend to suicide. And so she understood exactly that pain. And that's where we first started. We were at the University of Delaware, and we started a club called Friends for Friends that's still active on campus. And that emphasized the role of friendship, especially in, a higher ed setting, in a university, or in medical school, law school, continued learning. There is a lack of awareness, and we wanted to just normalize it in that setting and emphasize the value of peer support. Like, you can help a friend get help. And that was kind of the first bud of what led to the growth of Mental Health Global Network outside of the university. But we still work with that group as well. But we need people to make this cool. Psychology has been kind of like an untouchable topic, or, people think that they don't have a clinical background, so they don't want to say the wrong thing or don't know what to say. And all we need to do is just be for the people, by the people, just breaking it down. Like, it doesn't have to be academic and stiff. Like, it can be engaging and interesting and fun to learn about.
And talk to us about how you're going about that. I am understanding you've already helped hundreds of staff there at University of Delaware, individuals throughout the world. Talk to us about how you're going about the training and letting people know what to look out for and other things that are surrounding the mental health illnesses that we see today.
Certainly. The course covers the signs and symptoms of various different illnesses, and then ties in how to listen, how to not be judgmental, how to initiate these conversations and provide that reassurance, and then how to outsource them. So how to actually connect them to professional treatment. And so these trainings, we were doing them in person. We've trained a lot of staff and students at UD, but due to COVID, we brought it virtual. And now that's been such an amazing thing, because we can access people from all over the world. about twice a month, we do a public training that anybody can sign up for. And then we also do private trainings for companies or schools. And the idea is just to train the everyday bystander. If the everyday person, if your buddy or your roommate can say the right things, then you're more likely to not complete suicide and to continue to live and find hope. And that's all that we want to do. We just want to provide hope, and it will only be normalized if it's on the same level as physical health. If we're teaching about physical health, then that should at the very least include mental health, and not just one sentence about depression. It needs to be, mapped out and clear, because people are more at risk of suicide than they are to have a cardiac arrest, especially young people.
And what are some of the things that you would say play into our daily lives that can add or heighten our suicidal thoughts? I know before you and I have talked about just things like missing a meal, overworking yourself, staying up late at night to try to finish an assignment. Talk to us a little bit about what you've seen and experienced through Mental Health Global Network that has exposed you to other things that people are facing on a day-to-day basis that contributes to this thought.
We are exposed more than ever before. Between social media, with COVID, we're experiencing meaningful losses, and it's a lot to process, especially when you're young. And we're setting these unrealistic expectations for social validation. You post something we're literally releasing serotonin on levels that we can't keep up with. And what that does is it makes us unable to cope, and it makes it more challenging to find satisfaction in life. If you're constantly reaching this level of immediate gratification, then how do you endure suffering, and how do you cope with daily stress? And in our course, we talk about the spectrum of mental health. People ask us a lot, what's the goal? Happiness. And how we measure it, or how we look at mental health, the spectrum of it, it ranges from being healthy to being in a state of crisis. And then in between, we see stress and struggling. So the idea is to identify these issues when someone is just stressed before it gets to the point of struggling, and then before it gets to severe cases. Stress is normal. It's actually one of the greatest motivators. However, ongoing stress over time can lead to mental health issues. Trauma can lead to mental health issues. And I think that's why there's such an awakening right now because of COVID. The disruption of routine and isolation makes mental health issues thrive off of that. So people who have always found comfort in their routine are suddenly being stripped of that. People who found comfort and satisfaction in their jobs are now losing that. So we need to teach people how to grieve. We need to teach people how to look out for one another. And we need to just normalize these topics, because the only way to instill hope in someone is to give them the opportunity to express how they feel.
Let's talk about the differences in regards to your organization, because right now, most corporations, they have what we call EAP, which is going to help them seek therapy. So an employment assistance program, for example, can help an employee seek some type of therapist for whatever they might be facing. If it's suicidal, another type of mental health, if it's learning how to grieve with the loss of a loved one. But here you're kind of doing something different, and you're really connecting individuals to not only people that can help them, but to better understand what it is they're going through, and to also help them to the other side, recovery. So talk to us about the differences in regards to what your organization does in regards to other organizations that are out there.
Right. We are not treatment. We are, somewhere in between the issue manifesting and getting them to that treatment, whether that's a psychologist, a psychiatrist, if that's within their EAP network. And we partner with EAPs to help provide our training. But also, yes, people have access to a psychologist. Yes, people might have insurance coverage if they're lucky. That's a whole nother issue, people who don't have insurance. We also talk about how to find someone within your insurance network in the course, as well as what options are available if you don't have insurance or you don't have the funds for therapy and treatment. However, people don't want to go get help. There's still stigma. Even, I have friends that work with me in the mental health field, and they're like, oh, I'm fine. Like, I don't need help. And so we need the everyday person to be more persuasive in terms of getting someone to that appointment. There's only so much availability. A lot of psych treatment is within the 10 to 5, 9 to 5 window. So what happens after hours? And that's why if we train our communities, then those people can be that, first responder until we can get them to help. And even in hospitals, we have some clients in hospitals that say they're nurses and doctors, they have access to therapy and they're experiencing increased trauma related to COVID. And you think that a nurse who works 16-hour days, 5 days a week on their 2 days off, that they want to go see a therapist, they probably have weekends off. Like, there are still so many barriers to treatment, but if we can provide peer support through this training and have everyday community members feel more confident, then we can be part of an early intervention effort.
And that's very important. I'm so honored that you were able to enlighten us on that, because it's very important for one to just acknowledge the fact that they need help. And there's so many factors that can go into that. One might think it's only pride, but it's not. As you mentioned, it could be work schedules. It could be fitting it in, or it could be, let me just put work first and I'll deal with myself later. And that type of behavior is what adds to other problems later down the road. But one thing that you've done that's very proactive that I am a fan of, I have a child who has multiple food allergies. And so she has an EpiPen and an action plan. She has chronic asthma as well, and she has an asthma action plan. One thing that Mental Health Global Network created is a mental health first aid kit, one of its own that I've never seen before, that I myself can put in my purse along with my child as we go out and about into the world. Talk to us about the birth of this mental health first aid kit and why you saw the need for it to be available to so many people.
Our course includes an action plan that's applicable to any scenario, and it gives people kind of like a structure to think about it, just like they would with regular CPR. And as we continue to train, we realize, like, we wish we could give our participants something tangible. And in the same way that someone who's more conscious of physical emergencies might be like, oh, there's a physical first aid kit, or there's an AED in this facility. It's important that in schools, at the very least, that there are tangible coping tools for mental health. So we created a kit that has 9 tangible tools for coping with stress, anxiety, and sensory overload. And the goal is to just kind of, you have tools on hand, and that can be reassuring. It can be reassuring for a child to know that their teacher announced at the beginning of the year, here's our mental health first aid kit. If you're ever feeling down, come talk to me. And that's how we establish what we call brain allies, people who are either trained or people who, are spreading the word in their community. And that's how we demystify mental health. And someone might not be open to take the training yet, but if they're open to this cute little bag with things that can help, that can start that conversation, and that can show your community that you care. Plus, people love getting, a little kit. It's portable, it's sustainable. You can keep it in your backpack, you can keep it in your workplace, and, it's cute, but it also can be very helpful. And all of the items have been proven to decrease symptoms of mental health issues.
And let's talk about the items, because one thing that I adore is that you speak to so many different people. So what might work for one may not work for the other. For example, a stress ball may not be as beneficial to me, but the essential oils will be very beneficial to me because I love lighting candles and things of that essence. But here in this kit, you've provided a variety of options for the person who just needs that first aid kit when it comes to their mental health. Talk to us about that and how you made sure you incorporated so many different elements.
Yeah, I mean, we did a lot of research on things that have been proven. We have a lot of psychologists involved in our team and discussing what things help, what things don't. But we also provide instructions on how to use each item. So, like, how many people have received like a random stress ball at some type of event and, you take it home, but you never use it. But in our instructions, we talk about using it as a meditation device. And in the training, we talk about different breathing exercises. So different ways to kind of use the kit also as a meditation device, not just as you would simply think each item can be used. We have calm clay in the kit that people can use this Play-Doh and play with. We have a notebook we're still developing the concept and doing a lot of case studies on what people like, what people don't like. We have plans to add a coloring book, but it's definitely, you know, one of the first of its kind, and we feel excited about that. But it's a great opportunity to just, you know, get this out there and to just normalize mental health. If you have a physical first aid kit, why not have a mental one?
And your organization could focus just on adults alone because it's kind of in the adulthood when people are affected, but you made sure that you also reached out to children as well. Talk to us about why you wanted to make sure you tackled all age groups in this organization.
Definitely. I don't think our society has ever seen a time like this. Like 2020 has been the worst, and I'm sure you agree with that. And so, what must it be like for a child? And even before, you know, we're all lucky that we grew up at a time where we can critically engage with social media. And I can't imagine growing up with an iPad and what impact that can have on mental health. And like I talked about before, the life is the ability to delay gratification. Life is waiting in lines and then feeling, you know, the joy when you get to the front of the line. And so if we can't delay gratification, then we can't endure suffering. And that's where, you know, people are more entitled, or not even that it's necessarily a character thing, but that's where it truly is in someone's mind. If they've been used to receiving this level of validation and then they don't, that can be traumatic, and that can shape one's mind and responses. And kids, it's a hard time to be a kid these days. And there's not even a lot of research about how social media affects the youth because these kids haven't grown up yet. But what we do know is that there are serious repercussions from this kind of media on learning, on attention span, as well as on mental health.
And that's so fitting because right now, because of the pandemic, all the students are doing learning virtually, so they're spending more time online as opposed to that person-to-person connection, which could add to the emotional draining that a lot of kids are facing today because they're missing their friends and they're not in school.
Yeah, and even before COVID, we were lacking, you know, that human compassion, human connection, and we need that. Kids need that. And yes, you know, we need to not be sick more than that. But at the same time, how do we, you know, go from here? And what are the long-term effects? Like, are we never going to shake hands again? And are we never going to hug? Can these kids not hug their teacher? Can these kids not, you know, hold hands and run in the hallways? Whatever, all of that is part of our learning about relationships. So if that is taken away, then it's really important that we at least know how to identify other things and provide support in other ways besides that, you know, touch, that intimate connection.
And let's talk about how Mental Health Global Network is actually persevering through the pandemic. As you mentioned earlier, this has been an epidemic prior to COVID-19 hitting our country. Now that it's here and it hasn't gone away, and this is the norm for us now, talking like this virtually, meeting people virtually, as opposed to, like you said, touching and hugging and just embracing one another. How has your organization stayed afloat during this pandemic, and what are you doing to continue to spread awareness for mental health?
We are figuring it out. In the beginning, we were like, okay, now what? You know, we had a lot of events canceled in the spring, and that was disappointing. And then we just started developing it more. And we are working with a technology partner to develop an automated training as well. In the meantime, like right now, what we're doing is live, and it's basically what we were doing in person. Now we're just doing it online, which has actually been great. We didn't want to do that in the first place because we were like, oh, we like the human connection. We like being in person and getting the group together and sitting in a circle. And there is a lot of value in that. But in today's day and age, we have to adjust. And the good news is we've had people from New Zealand, Australia, from India, from all over the world that would have never been able to take this training. And that's what matters the most to us at this point. It's challenging, and I don't like sitting in front of Zoom and talking about, I mean, I do because we're spreading a message that I believe in, but we got to do what we got to do, and we're not going to stop spreading this message because people need help now more than ever. And it's scary. It's a scary time for all of us.
It is. And how are you managing yourself? I usually like to do a mental health check-in with people on this show. And I haven't done one. And this is so fitting right now since we're talking about mental health. How have you been able to just cope yourself in the role that you're playing in our community?
It's hard. I mean, I might lead seminars on what to do and how to help and based on science and fact. But at the same time, like, I struggle with my own mental health still. I struggle with the fact that the world's shut down and that no one has answers and no one can really provide comfort to me, because we're all just stuck, and it's a harsh reality. But I do find comfort in the fact that there are a lot of people who have good hearts who are going to learn something. And if they take away anything from our course, that means a lot to me. And that's kind of helped me persevere through this hard time. But finding my own routine and feeling productive has been an ongoing challenge. And I'm still trying to find that balance. And for anyone else who feels like this, it will get better. And look how much we've adjusted so far. Like, when this first hit, it felt like it was going to be 2 weeks and it felt like a snow day or something. And then now it's like, okay, this is a reality, and humans are resilient. And that's one of the beautiful things about mankind, is that we can adapt and that we can adjust. And through the right support, we can make it through.
Yes, we can. And making it through, you are. Talk to us about, what do you have in the horizon for Mental Health Global Network? What can we expect? Anything you can share with us?
Absolutely. So there's still a lot that I can't say, but we are working on building, an automated version of this, software as a service. And I think that will just help us scale and reach so many more people. And something that we want to do, we want to be academic. We want to be that source, but at the same time, we want to make it not corny. And we want to make it not like, oh, I have to do this training. Like, we want people to be like, wow, I never thought of it like that, and feel inspired and feel like, that it's cathartic to be involved in this kind of conversation. And with that being said, that's what makes us different, because we are regular people. Yes, we have psychologists involved, but we're trying to teach the everyday person. And some of, the most brilliant scientists and medical professionals, they don't want to teach the public. Their scope is that 9 to 5, and they're helping the mental health community in that way. But who else? Because we kind of have, a lot of nonprofits that do great work, that have research and that have fundraising efforts. And then we have psych professionals who, work in the window that they do. And so where can communities and bystanders get involved? And that's by getting trained.
And Kelly, for those who are completely unaware, could you paint a little small sample of what the training actually looks like? Because I can see this going into not only universities, but high schools, elementary schools, the foster care system, domestic violence nonprofit organizations. I mean, the list goes on, because mental health attacks us in so many different ways, especially just for the parent at home, the single mother, the single father, or the working grandparent who's taking care of their grandchildren. I mean, there's so many layers. Like you mentioned, there's a spectrum. We're not talking about going to a therapy session and asking, what is your pain from a scale of 1 to 10? This is way beyond that. So paint for us a small glimpse of what your training actually looks like. So for these providers who are out there, who are interested in how maybe just putting this into their curriculum or putting this as part of their schedule, talk to us about what they can see and expect.
Right. So we include an action plan, but first we map out what do the signs and symptoms look like? So what are warning signs? What can we look out for? And then once we do notice something, how do we start that conversation? So how do we really listen, and how do we provide reassurance? And what things are harmful to say, because how many people, might have good intentions, but then they say something that is stigmatizing and they don't even realize. And then that can be a further deterrent for someone who's truly struggling. And towards the end, we also go through coping mechanisms. So essentially we talk about what to look for, how to help, and then how to follow through and actually connect them to treatment. And we just bring in, the human side. We're not saying, hey, call this hotline, or hey, go to this link and read about, this issue. We're saying, hey, call their insurance company, find out who has availability that they can go see, go to that appointment with them, and how to really be involved in that process. And you can save a life. You can be part of an early intervention effort. And if we can help people when they're stressed out, when these issues first start, instead of being like, well, I hope they're okay, I don't want to bother them and say anything, which is typically the response. If we are confident and brave enough to say, hey, I notice this behavior, I'm worried about you, and I really care about you as a friend, so I want to help you get help. You would do the same for me, right? And just talk about it like we're saying, hey, I want to go to the mall. And that is really the first step. Anybody who wants to get trained, then you learn things that you can then, demystify this topic. You can go into your community, correct people, if people use a mental illness as a negative or as an adjective and say something like, oh, I'm just going to kill myself. That one person who's trained could say, hey, don't say that. Like, if you mean that, I'm worried about you and let's talk about it. But if you're just saying it like as a hyperbole, then, that might deter someone else from getting help if they need it, if they hear that as just a joke. And really breaking that down so people realize the impact of what they say, and interactions make a difference. So if we can make an informed, conversation, if we can create these informed conversations, then we can have, a clear goal and be part of that effort.
With that being said, I love to leave the virtual floor to my guests at the very end to really just share any words of inspiration or advice that you can go ahead and give to our viewers that'll help them along the way during this pandemic as we all cope with our mental health.
Absolutely. There's so much that you can do. Mental health is vague, and positive mental health and wellness is a process. It takes ongoing maintenance, it takes effort, and it's okay to not be okay and to sit with that. It's okay to feel pain and disappointment and complex emotions and to feel that's you're supposed to, so that you can heal from it. But you also might need help. You also might need to open up and not bottle it up. And there's so many options available for you. So you could talk to your primary care physician about your mental health, talk to a loved one, find out what's available in your local area and make that appointment. If you know someone who's struggling, make that appointment for them. There's so many apps out there for therapy. There's so many virtual options, and you're not alone. So if you're struggling, pick one person. I challenge you to pick one person that you talk to about it today. And I'm sure that they will help you, because anyone that, your friends, family, they care about you. And even if you feel like you're a burden, or you feel like, oh, I don't want to bother them with my mental health, it's not a burden. It's our pleasure to support our loved ones. That's what being friends is. That's what, our communities are for. So if anybody's struggling, don't be afraid to speak up about it. And through practicing self-care, you can work on your mental health. And, it's not a bad life, it's a bad day, and you've had bad days before. So if you're struggling, just know that things will get better. You've made it this far. You've gotten through a lot. And as a society, we're going to get through COVID. We're going to get through this mental health crisis, and through education, and also just from being an advocate in your own community. You don't even have to be trained to spread positive awareness and to demystify the topic of mental health. So for anybody who's out there, seek help. There's no shame in that. And you can be part of, helping other people too. Recovery is possible, and it requires time and participation, but in the same way that if you broke your leg, you would seek help from a doctor and then, practice your physical therapy and be involved in that recovery process. Mental health requires the same kind of commitment. And don't get discouraged if the first therapist doesn't work. Don't get discouraged if the first person you talk to doesn't say the right thing. Find the people who will, and find the therapist that works for you. It's a process, but when people have a physical health issue, they get a second opinion. They don't give up and just say, oh, well, this cancer is bad, so I'm just going to see what happens. No, they seek help and they continue to be involved in that process.
Thank you so much, Kelly, for your time today and for normalizing mental health and really just shedding light on so many different issues that we're facing right now during this pandemic and ways that they can find help. This is very important for all of us. I just appreciate the time you took today to shed some light on that. Thank you.
Thank you. Thanks for having me and for being vulnerable yourself in this conversation. I think that this message is one that will really hit home for a lot of people this time in 2020, and we're going to get through it. So thank you for all that you're doing to shed light.
My pleasure. You're welcome. And thank you for joining us on this episode of In Focus with Yesenia Taveras. It's been an honor to interview Kelly Mars and to learn more about Mental Health Global Network. For future guests, make sure you tune into WITN22 by following us on Facebook at WITN22 Wilm and subscribing to our YouTube channel at WITN Channel 22. I've been your host, Yesenia Taveras. Thank you so much for watching. I'll see you next time.